What happens to your body and mind when you masturbate too much or too little? Here's a fact most people don't know. Over 90% of men and around 80% of women admit they masturbate, yet almost nobody talks about how to do it safely. By the end of this video, you'll know what's normal, what's risky, and even one surprising habit that can actually reduce compulsive urges. This isn't clickbait, it's science-backed guidance that every adult should know. Before we dive in, hit that like button, subscribe, and drop a comment about your thoughts on this often taboo subject. This is about knowledge, not shame. Part 1: Understanding Masturbation, Why It's More Normal Than You Think. Timeline: Lifetime Habits. Imagine this: you spend years learning algebra, history, chemistry, but nobody explains your own sexual health. That's reality for most of us. Health classes give vague slides and diagrams about reproduction, but nothing about pleasure, boundaries, or healthy habits. Here's the truth: masturbation is one of the most natural human behaviors, and in moderation, it is beneficial for your physical, mental, and emotional health. Physiological benefits. Stress reduction. Masturbation triggers the release of endorphins and oxytocin, which are natural stress relievers. Sleep improvement. The release of prolactin after orgasm promotes relaxation and better sleep. Mood boost. Dopamine pathways are activated, giving you temporary feelings of pleasure and satisfaction. Scientific insight. A 2019 study in the Journal of Sexual Medicine found that regular masturbation was linked to lower levels of stress hormones like cortisol, especially in individuals under chronic stress. Personal observation. Many people feel guilt or shame after masturbating, which paradoxically increases stress and can contribute to compulsive behavior. Understanding what's normal for your body helps reduce anxiety and improve self-awareness. Part 2: Safe Masturbation Practices, the do's. Timeline: Daily weekly practices. 1. Maintain hygiene. Always wash your hands before and after. Clean any sex toys as you would your coffee mug. Stick to water-based or silicone-based lubricants. Avoid scented oils that can irritate skin. Scientific evidence. Improper hygiene can increase the risk of urinary tract infections, bacterial infections, and skin irritation, according to research from the International Journal of Urology. 2. Listen to your body. Pain is a red flag, don't ignore it. Avoid overstimulation or excessive friction, which can lead to micro-injuries or soreness. Real-life example: a reader once told me he ignored mild soreness after frequent masturbation, only to end up in the ER explaining persistent genital irritation. Prevention is always better than cure. 3. Experiment safely. It's natural to be curious. Toys are fine as long as they're designed for sexual use. Household objects are dangerous. ER nurses report countless injuries from them every year. Expert insight: using the wrong object can cause lacerations, internal injuries, or even infections. Think of it like using a kitchen knife as a screwdriver, you wouldn't, right? If you find these tips helpful, like, share, and comment with your experiences or questions about safe sexual practices. Part 3: Common mistakes, what not to do. Timeline: Habits to avoid. 1. Overdoing it. Masturbating excessively can cause temporary numbness, delayed ejaculation, or discomfort. Frequency alone is not inherently harmful, but context matters. 2. Ignoring injuries. Redness, swelling, or pain are signals to stop. Prolonged ignoring of these symptoms may lead to infections or more serious medical issues. 3. Unsafe comparisons. Everyone's frequency is different. Comparing yourself to unrealistic norms online or in media creates unnecessary stress. 4. Unsafe objects. If it's not made for sexual use, don't use it. If you wouldn't explain it to a doctor, it's unsafe. Scientific insight: high-frequency masturbation without attention to technique or safety can cause physical irritation and psychological distress, but when practiced responsibly, there are few adverse health effects. Personal anecdote: I've known people who masturbated compulsively to escape stress. When they introduced mindfulness, exercise, and structure, their habits normalized and overall mental health improved. Part 4: When masturbation becomes a problem. Timeline: Signs you need help. Masturbation becomes a problem when it interferes with your physical health, mental well-being, or daily life. Persistent pain or discomfort. Inability to stop despite wanting to. Using masturbation as a constant escape from stress, sadness, or trauma. Injuries or visible issues that don't heal. Expert insight. Psychologists classify compulsive sexual behavior as a mental health concern when it disrupts social, occupational, or personal functioning. Real-life example: one patient missed work and social events due to compulsive urges. Professional guidance provided structured coping mechanisms, stress management techniques, and behavioral adjustments. Within months, the habit normalized and overall quality of life improved. If any of these signs sound familiar, like, share, and comment so we can discuss practical steps for seeking help. Part 5: Healthy Alternatives and Achieving Balance. Timeline: immediate to long-term strategies. 1. Exercise. Physical activity redirects energy and increases endorphins. 2. Meditation. Just 5 minutes can reset dopamine pathways, reducing compulsive urges. 3. Hobbies and interests. Creative activities like painting, writing, or learning an instrument provide natural rewards for the brain. 4. Therapy and professional guidance. Talking to a therapist isn't a last resort, it's a shortcut to better mental and sexual health. Personal example: a friend replaced compulsive masturbation with a running routine. 6 months later, he was training for a 10K and reported higher productivity, better mood, and a healthier lifestyle overall. Scientific evidence. Behavioral psychology studies show structured distractions and reinforcement of new habits can reduce compulsive behaviors by 40–60% over 3–6 months. Part 6: Psychological Impacts of Masturbation. Timeline: short-term to long-term effects. Short-term, release of dopamine and oxytocin promotes pleasure, relaxation, and mood elevation. Medium-term, overuse can desensitize pleasure centers, leading to temporary decreases in sexual satisfaction. Long-term, balanced practices contribute to healthy sexual function, mental clarity, and emotional regulation. Scientific insight. Research published in Frontiers in Psychology 2020 shows that masturbation, when part of a balanced sexual life, reduces stress, improves sleep, and enhances self-esteem. Personal observation. Understanding your own patterns can prevent guilt and shame, fostering better mental health and self-confidence. Part 7: Societal Implications. Timeline: cultural and social effects. Stigma around masturbation leads to misinformation, shame, and unsafe practices. Open conversation encourages safer sexual habits and mental well-being. Knowledge empowers individuals to understand their bodies and make informed decisions. Fact: many adults only realize the risks of unsafe practices after injury or mental distress. Awareness prevents these preventable issues. Like, subscribe, and comment on how sexual health conversations are handled in your culture. Let's normalize healthy discussion. Conclusion: masturbation is normal, healthy, and manageable. Timeline: key takeaways. Masturbation is a natural and healthy activity. Safe practices involve hygiene, listening to your body, and using proper tools. Avoid risky behaviors like overdoing it, ignoring injuries, and unsafe experimentation. Seek help if the habit affects your life or causes harm. Achieve balance with exercise, hobbies, mindfulness, and therapy. Scientific perspective. Numerous studies confirm that moderate, safe masturbation is healthy, supporting both physical and mental well-being. If this guide helped you, hit like, subscribe, and leave a comment about what taboo health topic you want us to tackle next. Knowledge is power, and understanding your body is freedom.